Marta Valenciano has worked on public health at a national level at the French National Public Health Institute from January 1999 to October. Before that, she was an Epi-Ed who graduated in 1999. She's worked at WHO, the disease surveillance and response team in Lyon, and then she joined Epiconcept, and she's been working at Epiconcept since 2007. And that ties in also with the start of the studies on influenza vaccine effectiveness being conducted. And she's been one of the masterminds, as I understand, and the forerunners when it comes to work on influenza vaccine effectiveness. And I would now like to give Marta the floor. And Marta, please share your screen and welcome to this meeting. We will have another special guest in this meeting, and that is Andrea Amon, who will join us for the celebratory part of the meeting.
Thank you, Ines. And I'm extremely happy to join Eurosurveillance and all of you in this celebration. I hope you can see my screen. As Ines has mentioned, I will talk about the impact of Eurosurveillance on the influenza community. Just to mention that Epiconcept is also celebrating the 25th, its 25th anniversary. So they are, Eurosurveillance and Epiconcept are of the same birth cohort, which is nice. So I will also talk not only as Epiconcept, of course, but as a coordinator of the 𝘌𝘶𝘳𝘶𝘳𝘷𝘦𝘪₏ network and how Eurosurveillance has really support our network. So just to start, in a rapid scan of Eurosurveillance publications about influenza, just by typing articles with influenza or flu by year, we see that Eurosurveillance has published since 1996 476 articles on influenza covering different aspects. So virological and clinical surveillance, seroprevalence, virology, mortality and its impact, of course, pandemic influenza, but also a lot of work on vaccines, the impact of introducing childhood vaccination, for instance, and then, of course, vaccine effectiveness. And my talk will focus on vaccine effectiveness. So influenza vaccine effectiveness, as many of the public health issues, is in constant evolution. In 2007, we started the Influenza 𝘌𝘶𝘳𝘶𝘳𝘷𝘦𝘪⑭₀, Influenza Monitoring Vaccine Effectiveness, that is a European network with the strong participation of public health institutes, primary care networks, hospitals, and national influenza centers. The network is funded mainly by USCDC over the years, but also member states. WHO Euro has also funded some years, and also for some years Epiconcept has contributed, and it's under the coordination of Epiconcept. So it's a multi-center study, and we use standard generic protocols. But 𝘌𝘶𝘳𝘶𝘳𝘁 goes beyond Europe, and we have strong collaboration. We have built over the years strong collaboration with international teams working in the area of influenza vaccine effectiveness. So we worked in close collaboration with the USCDC and Marshfield Clinic, with Canada, Australia, Hong Kong, PAHO network, and also Israel. And in setting up all this international collaboration, Eurosurveillance has helped a lot in sharing, helping us discussing hypotheses, and helping us also to progress in knowledge. So if we focus now on the publications on influenza vaccine effectiveness between 2006 and now, we see that in all journals there have been 730 publications, and that Eurosurveillance has published more than 10% of them. So quite impressive. Ines, we invited Ines to one of our 𝘌𝘶𝘳𝘃 annual networks in 2017, and then there she summarized the work that Eurosurveillance was doing did between 2013 and 2007, And she mentioned that Eurosurveillance received 75 submissions, and that of these 38 were published from 9 countries, and that 25 of the published articles were from Europe, coming from 6 countries, and then the European estimates. And we can see here how Ines was discussing how to communicate those results with Amparo Larrauri and Nick Andrews. So Eurosurveillance has really been a pillar in supporting the launching of the European influenza vaccine effectiveness estimations. And going back to 2006, the first question was, how can we measure influenza vaccine effectiveness in Europe? And then 𝘌𝘌𝘳𝘰𝘴𝘶𝘳𝘷𝘦𝘪₁ at that time, and the team in SSI led by 𝘌𝘁𝘁 published an article on Eurosurveillance explaining the need of influenza vaccine effectiveness in Europe. So the rationale was that in 2003-04, the season 2003 and 4, influenza vaccine was not containing the H3N2 virus circulating during that season, and that vaccine effectiveness estimates were really needed but unavailable. So they pilot a system to see if laboratory-based surveillance could be used to measure influenza vaccine effectiveness. The conclusions in this article is that, well, there were small numbers at Danish level to interpret the vaccine effectiveness, and therefore they recommended that a EU multi-country study could be set up to measure vaccine effectiveness, so that the estimates would be available earlier in the season for different age groups, for emerging virus strains, and then for new, of course, and pandemic subtypes. So in 2007, ECDC, and at that time it was Bruno Ciancio leading this work, launched a call for tender on methods, to identify methods to measure and monitor influenza vaccine effectiveness in Europe. So Epiconcept, in consortium with some public health institutes, we responded to this tender, and then we started to work as iMove. So in 2007, that was the first year we started to work. We tried to continue to see to answer to the question how to measure influenza vaccine effectiveness. And after the first year in which we conducted literature reviews, interviews, expert meetings, we published this article, the first steps in the design of a system to monitor VE during seasonal and pandemic influenza in Europe. And we concluded that the data sources, we tried to identify data sources to conduct influenza vaccine effectiveness really varied by member state and within member states by regions. And that there were some quite interesting computerized databases, electronic registries that could be a good basis for large cohort studies. That was in Denmark, UK, that there were in all member states sentinel GP networks working on influenza surveillance, and with laboratory confirmation of influenza cases, and that they had also vaccination status at that time for a subset of the population. And during the literature review that we did, we understood that really influenza vaccine effectiveness varies with age, risk group, and the specificity of the outcome measured. And of course that these observational vaccine effectiveness studies could really be heavily biased by positive or negative confounding. So with these ideas in mind, we developed with all partners a protocol, and we wanted to pilot it in the following season 2008-09. So that was the pilot season, and we published the results in Eurosurveillance again. So in this pilot season, only 5 countries participated, and we were measuring influenza vaccine effectiveness against all influenza. We could not measure at that time influenza by subtype. And the study population during that pilot was restricted to elderly and was based on sentinel primary care surveillance networks. what we learned in this pilot season and that we shared with in Eurosurveillance, the adjusted influenza vaccine effectiveness during that season was 59%, and that the results suggested that we could use the test negative design, so the case control study test negative design, to measure influenza vaccine effectiveness against a very specific outcome, lab confirmed outcome. So that was feasible in Europe. And that by pooling country-specific data, we could provide early seasonal or pandemic vaccine effectiveness and increase the precision of estimates for subgroup analysis. So in that publication, the pandemic was already arriving, so we concluded that in 2019 and 10, the 𝘌𝘶𝘃 would measure influenza vaccine effectiveness in groups targeted for the vaccination. So the pandemic came, 2009-10, influenza, and then Eurosurveillance really worked hard to publish to share rapidly results from vaccine effectiveness. So on 6 August 2009, the 𝘌𝘃𝘃𝘶𝘃𝘴𝘶𝘳𝘃𝘴𝘶 group in Australia published in Eurosurveillance the pandemic vaccine was not yet there, so that there was no evidence of protection from the seasonal vaccine against pandemic. That was the first question that we had during the pandemic, if the seasonal vaccine could play a role. And they concluded that there was it was necessary to vaccinate with the specific pandemic influenza vaccine. Then another rapid communication during the pandemic was from Ole Wichmann and his team at Robert Koch Institute that provided the first results of the pandemic vaccine effectiveness, concluding that the pandemic vaccine, so including only the pandemic virus, was very effective with more than 95% effectiveness among the younger age groups and 83% among those age 60 and more. And that for the influenza vaccine, it's really exceptional. So very good vaccine, and Eurosurveillance was there to share the results. A little bit later on, research articles were published. So results from New Zealand that was still exploring the effect of seasonal influenza, because there were rumors that people vaccinated with the seasonal vaccine were at higher risk of pandemic influenza. So the New Zealand team concluded in Eurosurveillance that the results were not conclusive. And then Public Health England team published the results of the seasonal vaccine against the pandemic virus, and saying that there was no evidence of the vaccine protecting against the pandemic, and showing a high pandemic influenza vaccine effectiveness very shortly after vaccination. Just from 1 week after vaccination, the pandemic vaccine was effective. So, but during the pandemic, so the good news was that the vaccine was extremely good. But if you remember, there was the issue of the association of the pandemic vaccine with narcolepsy, and Eurosurveillance very rapidly in the news shared the information that the EMA was releasing. Also news about the results of in Sweden, and then later the reports of Ireland and Canada exploring the association of narcolepsy and pandemic vaccine. So that's also the Eurosurveillance has always been extremely useful for the influenza community to rapidly share alerts in a virus that it's evolving up every season, and for which the vaccines have to be changed every season. So in terms of alerts, here it's an example. So again, a rapid communication from the 𝘌𝘃𝘃𝘃𝘃𝘃 network. So that after the primary care network, we set up a hospital network, and in the season 2016-17, in which H3 and 2 was circulating, the influenza vaccine effectiveness was very low, Overall 17%, and in those age 80 years and more, 13%, point estimate of 13%. So the virus was not changed. So it was the same H3N2 virus in the 2016-17 and in the 2017-18 vaccine. So we wanted to alert that as the vaccine was not changed, if the same virus was circulating or similar virus was circulating, it could be really a public health problem especially for the elderly. So we could publish these rapid communication just before the vaccination campaign and the influenza season. So extremely useful channel to communicate rapidly information. But not only Eurosurveillance has published results or rapid communications, there has been also articles, editorials written about the influenza vaccine effectiveness. And in 2013, 𝘌𝘶𝘃𝘶𝘃 and Ines published an article, an editorial on how complex it is, not only assessing the effectiveness, but on how to communicate those results, because it's the only or the main public health measure we have against influenza, but the vaccine, it's not really very, very good. So they concluded that even if it's difficult and to interpret the vaccine effectiveness, influenza vaccine effectiveness, there was a need to support the use of existing vaccines, especially in populations at risk of severe outcome, and that they hoped that the influenza vaccine researchers would continue to refine study methods to estimate the benefit that can be expected from inactivated influenza vaccines. Then in 2013, Gaston Dessert and his team in Canada published a more methodological research article on validating the test negative design, which is the design we are mainly using to measure influenza vaccine effectiveness and now COVID vaccine effectiveness. So a methodological article comparing the results of the T&D with a randomized placebo-controlled trial. And he concluded that there are some limitations, but anyway, that it's a good design to measure vaccine effectiveness. And in February 2016, Richard Peabody and Corey published an editorial on the importance of timely monitoring of seasonal influenza vaccine effectiveness. Eurosurveillance has also helped all of us to communicate and to share with our hypothesis and how we test hypotheses on influenza vaccine effectiveness. So things that we have been learning over the years. So what is the effect of previous infection? What is the effect of previous vaccination, influenza seasonal vaccination on the current influenza vaccine? Is there waning immunity? And all this, now we can see that with COVID vaccines, we have the same questions. And then the effect of imprinting. So in terms of previous vaccination and previous infection, with all our international colleagues, we started to stratify our results in 2015, 2016 by previous vaccination, by previous influenza vaccination. The Navarra team, the region in Spain, has worked a lot on this, and in 2016, they published an article assessing the effect of a previous influenza episode and of previous vaccination.
Yeah.
So they concluded that a previous influenza episode provides a high protection against the same virus subtype. The vaccination in that year had only a moderate protection against circulating subtypes, but anyway, that it remained the main preventive option for high-risk populations. Colleagues in Canada then pulled several years of their studies, 2010 and till 2015-16, and they concluded that the vaccine effectiveness decreased with increasing numbers of previous vaccinations. But that anyway, the current season vaccination provides some protection against influenza, regardless the number of doses received in the 10 previous seasons. And then recently, the Navarra team, which is really pushing all of us to always publish the results stratified by previous vaccination, they concluded that in all influenza vaccine effectiveness studies should consider vaccination in previous season, and that vaccination status should be collected in 3 categories: current vaccination, previous seasons, and unvaccinated. So that was one of the questions raised over the years. And then another one, of course, it's on waning immunity. We started also to measure vaccine effectiveness in different periods of the season. And in January 2013, we published 3 articles in Eurosurveillance, one from the 𝘌𝘶𝘃 network, one from the Navarra team, and one from the colleagues from Public Health England, led by Richard. And in those 3 studies, we really saw that there was a decline of vaccine effectiveness over time against H3N2. Then we continued really working and discussing again methods on how to best measure these with international colleagues. And then in 2016, with 𝘌𝘶𝘃, we published an article pulling differences from 2010-11 to 2014-15 season. And the results really suggested that there was a within season waning of influenza with increasing time since vaccination. And that was in this graph, you can see the vaccine effectiveness over time, by time since vaccination in days for H3N2, and really suggesting that after 120 days, we don't have, from 40 days, 30, 40 days, the vaccine effectiveness really decreases over time. And then more recently, in 2018-19, so most of the influenza vaccine effectiveness teams moved from measuring influenza vaccine effectiveness against a subtype to try to measure influenza vaccine effectiveness against clade and even subclade by doing a sequencing of the viruses. So in 2018-19, in Canada and Europe, we observed a quite negative and very decrease of vaccine effectiveness in the in adults. And we really started to work together to see why we were seeing these deep decrease in this group. So Danuta Skowronski and her team postulated an hypothesis, and they call that imprint regulated effects of vaccine, or IREV. So that's it. We observed in Canada, they observed that there was really a quite negative vaccine point estimate vaccine effectiveness against a specific clade circulating that year, 3C.3A, suggesting that adults of this age group vaccinated were at higher risk of infection compared to unvaccinated. So we know that there is imprinting by the first influenza infection. So when children are for the first time infected with one subtype, that confers long-lasting immunity that focus on towards priming epitopes. So the hypothesis was that the childhood immunological imprinting and the cohort effects following the 1978 H3N2 pandemic could have protected this age group, so the unvaccinated. However, in that year, there was a mismatch of the vaccine against these specific clade, so that resulting in a negative interaction of the vaccine in this age group among those vaccinated. So a quite complex mechanism that's an hypothesis we wanted to check. And we worked extremely closely with Ines and team to see how to present those results, because we were doing the analysis at the same time and exchanging with Canada a lot, IMOF and Canada, and we discussed with Eurosurveillance how to best communicate those results and how to best publish them. We agreed that it would be better to first publish the Canadian hypothesis, and then 2 weeks later we published the IMOF study, in which we measure influenza vaccine effectiveness by age and genetic subgroups to explore the vaccine effectiveness by birth cohort. And really we said that we would test the IREF hypothesis, making reference to 𝘌𝘶𝘰𝘴𝘶𝘳𝘷𝘦𝘪₏ article, that the lowest vaccine effectiveness that we observed in the birth cohort first exposed to H3N2 viruses was the reason of this deep decrease in vaccine effectiveness. And then there was an editorial of 𝘌𝘶𝘰𝘴𝘶𝘳𝘔𝘴𝘶 and Maria Zambron explaining further this hypothesis and mentioning the potential impact of distance influenza immune imprinting on current vaccination outcomes should be considered in the design of next generation vaccines. So that was 2018-19. We really wanted to continue exploring those hypotheses by doing sequencing in our studies, but well, COVID came, and I suppose we will continue exploring in the next months or years these hypotheses, in which of course we need high inputs from virologists and immunologists. So another quite important support and impact that Eurosurveillance has had in the influenza community is to help us communicating early season results, which are quite imprecise, which are difficult to communicate, but they are really needed to guide or to explore how the season is going. So it has helped us also a lot to push for, so that we to include the vaccine effectiveness results in the WHO vaccine composition technical meeting that takes place in February and September. So some years ago, vaccine effectiveness was not included as an evidence to define the influenza vaccine composition. So we, with our international colleagues, we organized this GIF, which is stands for Global Influenza Vaccine Effectiveness, which is an informal international collaboration of teams conducting influenza vaccine effectiveness studies using the test negative design. So what we do is we share all the results. One of the teams compile the results, and that moves for every report, and we present all the estimates we have by age group, by influenza subtype, by clade. So that report, at the beginning, we forced a little bit. It's the sharing with WHO. But now, after presenting the results, and now these vaccine effectiveness results are taken into account by the committee doing the selection of the strains for the vaccine. And this is mentioned in the WHO report that presents the results of the vaccine composition meeting. And really, Eurosurveillance has been a key partner to push for this inclusion. We can see here that the North Hemisphere early estimates, so that are used for the February meeting, have been published since 2010-11 for the European multi-center study, but also for other teams, so the early estimates of Navarra, of Spain, of Canada. So over the years, Eurosurveillance has really shared the early estimates in rapid communications and has helped a lot. But also the South Hemisphere early estimates used in the September meeting. So with publication of Australia, Chile, New Zealand, and then Hong Kong as well. And this early sharing of estimates has also helped the teams working to work together. So we were publishing independently those estimates, and with your surveillance team and with Ines, we said, well, we cannot publish 5 articles from Europe presenting early estimates. How can we organize that? So we now work with the other teams to summarize all the estimates and present it as early all together. So first we started just by presenting the 𝘌𝘶𝘃𝘴𝘶𝘳𝘷𝘦𝘪₏ primary care and hospital level estimates, but then really we worked with Spain, Denmark, UK to compile all this and provide a summary article presenting those results just before the vaccine composition meeting, or right 2 days after. I cannot see your message, Valentina. Sorry. Okay. So just in conclusions, the views of or summary of how Eurosurveillance has influenced the influenza community. So it has really helped us to adapt to the evolving knowledge, and we have seen that now vaccine effectiveness has moved from being measured against type to subclade, quite specific, and Eurosurveillance has accompanied us during this redefining of outcomes by age group, by risk group, and over time. It has really contributed to test new vaccine effectiveness hypotheses, as we have seen. A rapid sharing of results has been extremely important. And then also it's an outstanding opportunity for international networking. It's an excellent platform for publications of results from independent studies. And you will see that many partners, what they really appreciate, it's the rapid sharing of results. I mean, the influenza. So that's why Speedy Gonzalez is here. So I've asked some partners to say what is the impact for them of Eurosurveillance in the flu world. So for Navarra, which is a team, which is a small team and a small region, they really underline that they feel more united with colleagues from European countries through Eurosurveillance, because they really can share the results and they do an excellent work. Amparo from the Instituto Carlos III underlines that it's a great opportunity to get feedback from public health colleagues, a source of knowledge and learning, and also they always think of Eurosurveillance as the right journal for manuscripts. Jing McMenamin, who is the chair of 𝘌𝘶𝘃𝘴𝘶𝘳𝘃𝘴𝘶, again underlines the importance of rapid publication, yeah, that he really believes that the work has formed the basis of descriptors for COVID-19 pandemic vaccine effectiveness. Frederica from RIVM, again, the timeliness of publications of important results. Colleagues from ECDC, Pasi, he says he's one step ahead of outbreaks, and he has here a message that I don't understand, but those speaking Swedish will understand. And Cornelia says he's the 4-leaf clover among infectious disease journals. International colleagues, and that's, I think it's important for also for Eurosurveillance. Ed Belongia from US, so he says that over the past decade, Eurosurveillance has been on the cutting edge of research on influenza vaccine effectiveness. Sheena from the Melbourne University, she's impressed by the rapid reports and the skill of the journal team and the support of the reviewers who are able to do a rapid review in 24 hours and rapid dissemination on findings. Danuta underlines that the invaluable role of in dissemination of results, timely results, and that it has been the preferred journal to share mid-season estimates for all the networks. And she thanks all the team for the excellence and commitment to high quality public health research. USCDC sends a postcard And again, congratulations on rapid communications of mid-season estimates. And they have shown that with an animation in which we see the early estimates published by Eurosurveillance and then those published by the MMWR over time. So, yeah. WHO, Lorenzo Subizzi, virologist from WHO Geneva, really, again, appreciates the rapid sharing of important results. And Richard, who is a part of the Eurosurveillance family, wishes you good luck. From your Epiconcept, just, yeah, from all of us, we recognize that it's the best platform to disseminate real-time information that addresses the correct audience. We really like working with the professional editorial team, Alain, and the history of Eurosurveillance. He says that it's one of the networks reflecting the willingness of EU public health specialists to collaborate and create public health in the European. And for me, it has always been a learning process working with Eurosurveillance. So I think that's all, and just, yeah, felicidades from all of us.